The other one would be hypertension. You guys have heard of it before, probably called high blood pressure. Um, Hypertension is something that you can monitor at home, get inexpensive monitoring devices. Hypertension is a big indicator of metabolic health. And it probably is the number one indicator of poor cardiovascular health. So hypertension, high blood pressure, anything over 140 over 90, they consider high. Now remember, your body is meant to heal itself. If you have hypertension, you don't lack some blood pressure drug. You don't need to go on some blood pressure drug. I'm not saying that you shouldn't short term, but long term, your goal should be to not have hypertension. So what causes hypertension? So as our bodies are metabolically unhealthy, and usually we get bigger, usually you have more tissue to perfuse. Your blood has to go to other places. Your heart cannot pump hard enough to get to the blood flow up, so it increases in pressure. And that increase in pressure puts all kinds of strain on all kinds of things, like your heart and your kidneys. So in order to lower your blood pressure, you want to be ideal body weight, ideal body composition, put less pressure on your heart. It can lower, then your vessels can lower the pressure in there to help perfuse your outer tissues, peripheral tissues, and have a more efficient pump. Make sure that heart pumps harder. How do you make the heart pump harder? Cardio. We talked about that with VO2 max. You increase your VO2 max and make your heart a more efficient pump, and your blood pressure problems will probably go away. If you increase your VO2 max enough, your blood pressure problems will go away. Think about it. If your heart is really efficient at pumping blood, you don't need high blood pressure to perfuse all your outer tissues and your vital organs. So again, VO2 max is going to help decrease hypertension. Now, what about hypertension and salt? I know we've been lied to when it comes to salt and hypertension. And, people with kidney dysfunction or bad hearts already, which they don't perfuse their kidneys very well, they will be salt sensitive, and they need to really watch that. But most people that have healthy kidney function, salt is very, very, very important. And it's not about salt that makes us have high blood pressure. Well, you know what it's really about? It's about sugar. I talk about carbohydrates commonly, and I don't think carbohydrates are bad. I just think if you're eating carbohydrates, you need to be burning the carbohydrates. You need to be burning that excess glucose, which is what carbohydrates turn into.